Hit it.
Hi, I'm Dr. Katie Spoo, an associate veterinarian at Bellwood Animal Hospital, and this is my bearded dragon Pie, and we're going to go over the basics of a physical exam for a reptile. Pie is an 8-year-old bearded dragon, which is a type of lizard that's native to Australia, and this basic physical exam is how we would go through any reptile exam, whether it be a lizard or a snake or even an amphibian. So basically I start out by looking at Pie's outer body conformation. I look at her scales, her eyes, her nails, everything from head to toe. And what I'm looking for are any scratches or abrasions in her skin. I'm also looking to make sure that she's shedding appropriately. And Pie is in the middle of a shed right now. Lizards don't shed all in one piece like snakes do. They shed in kind of chunks. So if you notice, her skin color is a little different as she goes down her body, and that's because she's shedding in pieces. You'll also notice that she only has 3 legs. The front part of her first arm right here was cut off when she was just a little hatchling. So she has some special needs that take special attention. If your animal has special needs, we'll go over all of that on a case-by-case basis. But basically, I'm just looking for any little abrasions that she might get, because this part of her arm isn't a normal weight-bearing part of her arm like the rest of her feet are. So everything looks pretty good on the outside for her. Another common problem in lizards is that they can have difficulty shedding if their environment and their husbandry isn't normal. So I'll look very closely at her toes to make sure she doesn't have little bits of improperly shed skin, cutting off blood circulation to that area. This can also happen at the end of their tail, so I want to pay very close attention to those areas. Next, I take a good look at her eyes. Her eyes should be bright and clear, and they should be open all the way. She should be looking around like she is right now, wondering what's going on. Any discharge from their eyes is abnormal. If they're holding them shut, that could indicate that there's a problem with their eye, but it could also indicate that they're systemically ill. So if they have liver disease or kidney disease and things like that, a lot of times they'll be depressed, which they show by keeping their eyes shut. Next, we look in their mouth. We'll see how cooperative she is for this. Usually I'll use a tongue depressor or a spatula. You can even use a credit card to look in their mouth. Open it like this. Take a good look inside while she chews on it. I'm looking for any obstructions, any broken teeth. Make sure the skin on the inside of her mouth is normally colored. Everything looks good there. Take that back, thank you. Next, I take a good feel of her coelom, which is her abdominal and thoracic cavity. They don't have a diaphragm like people and dogs and cats do, which also means, I suppose, they can't get hiccups like we can. But I'm taking a good feel there, just to make sure that I don't feel any masses or impactions. Sometimes they can eat part of their bedding that can cause an impaction or an obstruction. I don't feel anything abnormal there. This is also very important in females, because females that are of reproductive age can sometimes have problems with egg binding. So we want to make sure that everything feels normal in there, and it does. Next, I'll flip her over again and take a good look at her back end here. I want to make sure there's no evidence of diarrhea or any discharge that's inappropriate there. Everything looks good. So that's basically what we do for a physical exam for these guys. The most important part of the physical exam is asking questions. So I'm going to ask you lots of questions about husbandry. So what type of cage you have, what type of food you feed, what type of bedding you have in your cage, temperatures, lighting, all of those things are very important. Sometimes if your animal's sick, it's because the husbandry isn't appropriate as opposed to an actual physical problem with the animal. So I'll probably have you fill out a long questionnaire, which can be frustrating, but is the best thing for us to get the most information to figure out exactly what's going on with your pet. If you'd like to call and make an appointment, feel free to do so. We'll see pretty much any animal that you have here at Bellwood Animal Hospital, so just give us a call anytime. Thanks for your attention.